Hello, welcome back to the Student Arts Network. It's Ryan here. Today, I want to bring you a very special video. Just trying to reach out to the public and let them know about some of these common misconceptions of a pharmacist. You see your common pharmacist like in your local community pharmacy or maybe in a hospital pharmacy setting. But did you know that pharmacists can do so much more than those positions? Or are you aware that there are some struggles out there for pharmacists to try to have a better working condition than just filling your medication? Here are the top five things of common misconceptions that people or the public might have about a pharmacist. Let's go. Point number one, which is one of the biggest misconceptions of a pharmacist. Pharmacist's only role is pill dispensing or putting pills in a bottle. Well, pharmacist uses clinical knowledge to ensure safety when the medication is dispensed to patients. You do not need a doctor of pharmacy degree, by the way, to actually put pills in a bottle. You can do that by becoming a pharmacy technician, as long as you pass your pharmacy technician's exam and you can certify to become a pharmacist technician in your state practicing. You will be able to fill your medication. In fact, most pharmacies actually have pharmacy technicians fill medication instead of a pharmacist. Pharmacists teach patients how to properly use their medications through consultation. There are different ways that pharmacists can use their knowledge or their clinical knowledge to teach patients on how to properly use their medication and making sure they're using it the correct way instead of taking something that shouldn't be taken mistakenly. There are other opportunities out there outside of just normal consultation when you receive your medication. There is something called medication therapy management, MTM, comprehensive medication management, CMM, which both have some similarity to it, but CMM is more of a patient-centered approach than MTM in general. I will have an article down here to help you to understand what's the difference between them if you are interested. Pharmacists also have other duties in the pharmacy, so including managing all staffs in the pharmacy or being in charge with techs and clerks, hold discussion with your doctors and your other providers, and have the ability to deal with any insurance issues or rejects, such as prioritization. Um, there is also the importance of being able to manage your inventory, especially with controlled substance or C2 medications, and many more. Point number two, pharmacist only works in a pharmacy slash community setting. Again, there are so much more pharmacists can do than just sitting at your local community pharmacy or retail pharmacy, helping patients to get their medication. Although a majority of pharmacists does have that job, there are different pharmacy fields out there that I believe that you should know about or be aware of. There is obviously the field of clinical pharmacy, where pharmacists can work in hospital or clinic settings to provide direct patient care under certain agreements. There is also the setting of managed care, which pharmacists mostly work in an office setting to work for insurance companies or pharmacy benefit managers to basically approve certain medications to be covered or not, or just go through regular formulary of whether an insurance would cover a particular medication. There's also pharmaceutical companies out there where pharmacists can act as medical science liaisons or any other clinical or research roles to help discover medications. Well, as a medical science liaison, you will be able to basically go to different hospital clinic settings to discuss about the efficacy of a certain new drug and see whether they could be able to willing to put it into the formulary. Otherwise, there's also different specialties of pharmacy, such as cardiology, psychiatric, pediatrics, oncology, infectious disease, etc. And there's many, many more for pharmacy students to explore when they're in different rotations. And the world of pharmacy is still expanding, so there are going to be future roles a pharmacist can hold, depending on the scope of practice we can have in the near future. Point number three, which I believe is a really, really common misconception, is that pharmacists have no rights to question a prescription or to deny filling a prescription. This misconception is so big. I was just in shock, because when I started working in a pharmacy, I would see how a pharmacist uses their knowledge to ensure safety, right? It is the pharmacist's right to actually question a prescription or even denying to fill a prescription to ensure, again, patients have to take their medication safely and not to dispense the wrong things by any chance. Just take a look at these couple of examples that I can find online just to see how these fraud or mistaken prescriptions can potentially have very, very harmful consequences. And if a pharmacist don't check it, well, it will be a horrible thing to happen to a patient. Just to give some examples, why pharmacists should have the rights to question prescription, the existing of faulty prescriptions, like I just mentioned, and the examples I've shown, the importance of different drug-drug interactions that lead to contraindication when you have multiple prescribers to prescribe a medication for patients. Something as simple as nitroglycerin versus sildenafil may cause excessive hypertension, or warfarin with other most antibiotics might cause too much anticoagulation. These are just some common ones that I think a lot of providers might not be aware of because they haven't got the whole patient profile and prescribe for different indications that which ultimately harm for the patients. So a pharmacist is there to just make sure that all the medications on the patient's list is safe for the patient to take. There's also insurance issues where a medication might not be able to be filled because it's not covered by insurance or requires a prior authorization. And the pharmacist's role in order to help with the insurance issues maybe suggest a alternative to a provider to see if there's anything that can be switched that so the medication is covered so the patient doesn't need to pay out of pocket. And I would say that in most instances, pharmacists will fill your prescription if possible and safely, and if there's no any other issues. However, there are a small minority of pharmacists who might not feel comfortable filling certain prescriptions based upon their own judgment, values, or practice laws, which did spark some controversy. And I believe that while it is the right of license for the pharmacist to make the call, I personally believe that there will be an ongoing fight in the future to ensure patients can have access to medications safely. Point number 4. Pharmacists are not clinically qualified to challenge a doctor, or pharmacist is not a doctor. In order to become a pharmacist, you need to obtain, at least in the US, a doctor of pharmacy degree. So every pharmacist spends 3 to 4 years of doctoral education to obtain their doctorate license, passing the NAPLEX exam and obtain their license plate in their state. Some might even have more training for 1 to 2 years of residency of a person specialty that is board certified. There is a strong evidence from this education showing that there is enough knowledge for a pharmacist to make decisions in regard to medications, because this is literally our job. However, there are major differences between a pharmacist and a doctor. A common example would be a pharmacist cannot diagnose. So if you have a certain condition, the pharmacist would not be able to diagnose you for that and prescribe you for medications for that. I know there are lots of, I would say, like misconceptions around how pharmacists might want to take other duties, um, or maybe to try to expand their scope of practice by maybe interfering with different health professions, practicing areas. But all I want to here suggest that pharmacists are here not to challenge the other healthcare professions or their perspective or their practice, but instead to work as a team to making sure that will get the most benefit to patients. A common example would be prescribing rights for medications that does not require diagnosis, something such as contraceptives or quit smoking products or Narcan, etc. Point number 5. This is not really a misconception, but I believe it's very important for you to acknowledge is that pharmacist is very, very accessible. I believe that Pharmacist is the most accessible healthcare provider in the United States. Consider you when you try to make an appointment with your local primary care provider, that it takes like a couple months for you to schedule one, or it just takes a long time to actually just see someone to help unless you're in urgent care or in a hospital where you're in urgent need for medical attention, which again charges a lot more. So if you have some really common um, illness, or just like something you maybe caught a cold or caught a flu, you just want a pharmacist to recommend you some over the counter medications for you to take, pharmacists are always there to help you. You can always just walk into a pharmacy and ask for the pharmacist for any health related concerns and see what's the best of action that you should take. And definitely is easier than waiting for your monthly doctor appointments than it's just going in to be just like for a 5-10 minute meeting. Pharmacists will be there for you to be able to discuss as long as they're willing to talk to you. There are some problems, however, out there, or some obstacles that pharmacists might not be able to discuss as much as they wanted to you, just because of the shortage of staff, the amount of prescriptions pharmacists need to fill every day, as well as things that just maybe not in the scope of practice of a pharmacist. But I do trust that if your pharmacist is allowed time to meet you to address your health concerns, they will. So that's it. That's my 5 common misconceptions of pharmacists that I believe the public should acknowledge and recognize. And hopefully, this can give you a better idea of what a pharmacist is, and they're just not actually just pill dispensing machines, but they're working in the back of the hospital clinic setting just to give you medications. I hope you enjoy this video. Click like and share if you like to just let other people know what a pharmacist does, and click subscribe to our YouTube channel, and I'll see you next time. Bye bye.